Welcome, caregivers, to today's in-service. We are happy to have you here. Today, we will be covering a course that was assigned to you in Care Academy titled Addressing Agitation and Aggression in Dementia. This in-service was created in an effort to help you as a valuable caregiver on our team recognize agitation and aggressive behavior in your current and/or future clients who are living with dementia. The Care Academy course discussed how to recognize causes of agitation or aggressive behavior in older adults living with dementia, how to identify the aggressive behaviors associated with dementia in older adults, how to determine strategies for preventing agitation and aggressive behavior in older adults living with dementia, and how to describe tactics for addressing agitated and aggressive behaviors in older adults living with dementia. Some key facts about agitation in dementia. Agitation occurs in dementia because the cells in the brain become damaged and affect the way a person communicates with the world around them. Agitation in the realm of dementia means a person is behaving differently than their usual personality or behavior. Agitation is common in people living with dementia, especially as dementia progresses. And those suffering from it can be more easily irritated, anxious, and quick to anger. Some common signs of agitation as it pertains to dementia are wandering, pacing, sleeplessness, crying, and tearing and/or shredding paper. If you have a client who has dementia and is exhibiting agitated behavior and/or characteristics, there are ways to help your client cope. Some ways to help your client deal with agitation. One option would be to change the environment. For example, Mr. Jones, let's go for a walk outside today. It's beautiful today. Outdoor activities is also a good way. Time in the sun, as approved by the client's medical team, has shown to improve the mood and demeanor of individuals experiencing agitation and may even improve their sleep pattern in some cases. Exercise is also a good way. Music therapy is a very calming option, and also to divert the client's attention towards an activity he or she enjoys. Some key facts about aggression in dementia. When a person becomes agitated, they may also have aggressive behavior. Aggression or hostile behaviors or attitudes can occur throughout the progression of dementia, but tends to become worse over time. Aggressive behavior may also be caused by something other than dementia, such as a new infection. So please make sure to call the office about any agitated or aggressive behaviors, whether new or progressing, as it may indicate an additional medical issue. What are the signs of aggression? Aggression in dementia can manifest in various ways, including but not limited to verbal outbursts, aggressive speech, damaging objects, shredding paper, and can also at times lead to physical aggression. Dementia can also drastically affect how the client is able to communicate using verbal language. Learning how to read your client's body language can be critical in recognizing signs of impending aggressive behavior. There are oftentimes warning signs that aggression is about to occur. The person may begin to raise their voice, scowl, or swing their arm at empty space. And like I mentioned before, learning how to read your client's body language is critical because we are trying to maintain the safety of both you and the client at all times. Ways to help your client deal with aggression. Reassure your client and speak calmly. Listen to his or her concerns and frustrations. Try to show that you understand if the client is angry or fearful. Allow your client to keep as much control in his or her life as possible. So, if there are some tasks that your client is still able to do safely, allow your client to continue to do so as long as there is supervision and it is cleared by his or her medical team and family. You want to try to keep a routine such as bathing, dressing, and eating at the same time each day will help prevent any unnecessary anxiety. Build quiet times into the day along with activities. And also keep well-loved objects and photographs around the house to help your client feel more secure. What are some ways you can prevent agitation and aggression? Sundowning is a condition where an individual suffering from dementia becomes more active during the night rather than the day, and it's very common, especially in the middle stages of dementia. Sundowning can often lead to increased agitation and aggression. By reducing or eliminating caffeine intake, maintaining familiar surroundings, and avoiding overexertion, you can greatly reduce the risk of sundowning. Reassurance and remaining calm are critical in not causing an episode of anxiety or aggression to escalate. Do not take anything personally. Your client is experiencing a large array of emotions and oftentimes mental and physical changes that they are powerless to control. These may or may not include hallucinations. You, as their caregiver, have the capability of helping increase their mental positivity and what oftentimes feels like a greatly distressing situation to them. Remember, although agitation may cause or lead to aggression, those who exhibit agitation with dementia will not always become aggressive. Aggression does not always equate to physical violence. And oftentimes, how we react as caregivers can be the difference on whether an episode of agitation can or will escalate to aggression. We can be the difference. So we'd also like to let you know how to get paid for this training. If you have watched this video and completed the online course, please send a text to 941-999-2609 with the following information. We would need your name, the date, and the keyword awesome, and you will be paid for this in-service.